with the University of St. Francis, and we're going to do the newborn assessment checkoff. Okay. So this is a female newborn. Her name is Jordan. And I'm going to start, I already washed my hands. I scrubbed them for 3 minutes, and then I put my gloves on. We don't have gloves in here, so put the gloves on. I'm going to check the baby's wristband. Make sure I have the right baby. Jordan Dormer, female. Okay. Okay, and I'm going to start with the vital signs on the baby. And I'm going to make sure to keep the baby warm during the whole time I'm assessing them. So first I'm going to take the temperature, which I'm going to do axillary. I'm going to place it underneath baby's armpit. And while I'm doing that, I can place my hand on the baby's chest for respirations, and sometimes it can take a while to get the axillary temperature. So I'm going to listen to that, or I'm going to feel for that. The normal axillary temperature is 97.7 to 99. This baby's is 90.2, so that's good. The normal respiratory rate is 30 to 60 breaths per minute. This baby's is 42, so that's good and normal. I'm going to next listen to the apical pulse, which you do have to listen to for a full minute with the stethoscope. So you're going to do that for a full minute. The normal heart rate is going to be 100 to 160 beats per minute. This baby's is 140 beats per minute, so that's good and normal. I'm going to check the heart tones while I'm doing the apical pulse. And I'm going to make sure that it's the regular rhythm and listen for any heart murmurs, which is going to be like a swishing sound. I don't hear any of that, so that's good. And then when you listen to the breath sounds, the best place to listen is going to be right above the nipple line on both sides, right here, and right here, for the upper lobes, and for the base of the lobes, it's going to be underneath the nipples, like this. Okay, so after you do that, the breath sound should be clear and equal. They may have some crackles at first, and that's usually pretty normal. It's just maybe some leftover amniotic fluid that's in the lungs, but I didn't hear any of that, so that's good. Then I'm going to move down, and I'm going to listen to the vowel sounds in all 4 quadrants. You start with the 2 above the belly button. Okay, and they should be active in all 4 quadrants. Okay, and then I'm going to start my head-to-toe assessment. I'm going to check, after I cover the baby back up to keep her warm, but I'm going to take her hat off, and I'm going to just kind of rub her head like this, and feel and make sure, like for molding, or like a cone shape, which can be normal and usually will go away. I'm going to check the fontanelles, the anterior and posterior. The anterior is larger. It's on the top. It's a diamond shaped, and it should be soft and flat. And then the posterior one is back here. It's smaller and triangular shaped, and that should be soft and flat as well. If they are sunken in, that could be a sign of dehydration, so that should be addressed and noted. You're going to check this sagittal suture lines, the anterior and posterior, and watch for gaps in between them. They can be overriding and on top of each other just from going through the birth canal. That's usually normal. You're going to check for any caput succidium. I'm not sure how you say that. Which is just a soft, squishy, swollen area. That usually is normal. Or a cephalohematoma, which is pretty much just a collection of blood and does not cross the suture line. So I don't see any of that. You're going to assess the skin on the head and face. You might see a little bit of melia, which is tiny little pinpoint white little dots or bumps on the face or nose, which is normal. It should be smooth and blemish free. I'm going to look for any strawberry marks, which are small, red, raised areas, or also stork bites, which are flat red areas above the bridge of the nose going up to the forehead. So I don't see any of that, but if they did have it, it's fairly normal. And then I'm going to assess the eyes. So the eyes should be from both ears, or no, sorry, from both the corners of the outside corners of the eyes. There should be 1/3, and then between the bridge of the nose and the corner of the eye, that should be 1/3, and then the other eye 1/3. So 1/3, 1/3, 1/3. Okay, I'm going to check for eye discharge. There shouldn't be any, but if there is, it should be noted. You're going to look for redness in the sclera, which can be a sign of some subconjunctival hemorrhage. Okay. Then, okay, then I'm going to assess the ears, which if you make like a straight line, like even with your finger, the top of the ear should line up with the outside of the eye of the baby, so it should be a straight line. You're going to check the recoil of the ear. You're going to first do it at the top of the ear and fold it down, and it should spring right back. If not, it can be a sign of immaturity or a preterm baby. You're going to do the same thing with the outside of the ear. You're going to fold it back and let it go, and it should recoil back fairly quickly. And then I'm going to undress the baby, which she's probably not going to like. And I'm going to look at baby's skin. Okay. I'm just going to look at the baby's skin for any peeling or any rashes. For lanugo, which is defined downy hair, most preterm babies have more of it, but it would be back here. Also, I'm going to look for vernix, which is the white cheesy substance. That's also, there's going to be more of that in preterm babies, and it's usually in the creases of baby's skin. You don't want to rub that off really vigorously. And then I'm going to assess for jaundice, which I'm going to press right here on the baby's forehead and let go. And I'm looking for like an orangish golden color when I do that. So I'm going to push on the forehead and then on the baby's chest, on the baby's abdomen, on the inside of baby's thighs. And I'm also going to look at the whites of baby's eyes and see if they have a yellowish color to it, which this baby doesn't, so that's good. Then I'm going to check the skin turgor. This baby's hip is kind of broken, but you're going to pinch the little bit of skin on the thigh to check the hydration status, and it should go right back down. I'm going to look at respirations when the baby's breathing while I have her clothes off. I'm going to look for signs of respiratory distress, which would be nasal flaring, retractions, which are little indents in the rib cage when baby is breathing, grunting, which the baby would make a grunting sound when they're breathing. Seesaw respirations is when the chest and abdomen fall and rise, kind of like a seesaw. And then also look for signs of apnea, which is when the baby stops breathing for over 20 seconds. So the baby doesn't have any of that, so that's good. I'm going to look at baby's abdomen and make sure it's not sunken in, and it also shouldn't be distended either. And then I'm going to look at the cord, and I'm going to do my cord care too, which should also be done with every diaper change and during assessment. So I'm going to take my alcohol swab and clean around the base of it. And I'm also going to look and see if it's wet, drying, or dry, and if it's clamped or unclamped. So this one is dry and unclamped. There should be no foul odor coming from the cord. If there is, it should be noted. It could be a sign of infection. Next, I'm going to assess the genitalia. This is a female baby, so obviously it's going to be different for a male, but I'm going to look at the, of course I'm going to have my gloves on. I'm going to look at the labia majora, which should cover the labia minora and the clitoris. If it doesn't, that could be a sign of prematurity in the baby. So yeah, make sure it covers, labia majora covers all that. If there is a white discharge or bloody discharge, that's normal, and it's probably just from the hormones from mom. So just go ahead and wipe that away. Like I said, that's fairly normal. So next I'm going to check for the muscle tone in the baby. Okay, so when I check for recoil, the baby's arms don't move. She's very stiff, so I'm going to do it on myself. You're going to take baby's arm and you're going to fold it up like this. You're going to hold it for 3 seconds, and you're going to pull it down straight and then let go. And the baby's arm should recoil back up. And then I'm going to look at the creases on baby's hand. At the same time I'm doing this, I'm going to make sure, count baby's fingers and toes, 10 fingers, 10 toes, make sure none of them are fused together. But I'm going to look at the creases. It should be more than one crease. If there's only one crease, that can be a sign of Down syndrome. So that everything looks good on there. When you look at the creases on the foot, it should be covered on the entire foot. That's usually a sign of a term baby. Preterm babies have less creases on their feet. And I'm also, while I'm looking at the creases, I'm going to assess for the Babinski reflex. Once you take a pen or some kind of hard object, you start at the bottom of the foot, and then you're going to go up on the side, and then towards the big toe like this, and the baby's toes should flare out. Okay, and then I'm going to flip baby over. Head to the side. This baby's a little stiff. Okay, and now I'm going to check the spine with my finger. You're going to want to make sure it's straight. Which feels pretty straight. You're going to go down to the gluteal cleft. And you're going to look for any dimples or tufts of hair, which I don't see, so that's good. You're going to move down and look at the gluteal smile and make sure the butt cheeks are even, and you're going to check for hip dislocation while you're doing that. And this baby is good. The hips look normal and the gluteal smile's even. So I'm going to flip baby back over. Now I'm going to check for the Moro reflex. You can do this one of two ways. You can either clap your hands, or you can smack the mattress of the bassinet that they're in. Either way is fine. I'm going to clap my hands, and then the baby should adduct and then abduct, or they'll make a C shape with their fingers. At this time, I'm also going to look at the baby's behavioral state. Are they awake? Are they crying? Are they really sleepy? This baby is awake and alert and crying because I've been messing with her the whole time, which is normal. I'm going to check and see when the last stool was, the last void was, and the last time she ate. If she's breastfed, she should probably be breastfed every 2 to 3 hours. Bottle-fed babies is usually every 2 to 4 hours. So I'm going to make sure I know the last stool, the last void, and the last time she ate. And I can either ask mom, or also I can look in the chart. While I have baby's clothes off, I'm going to want to weigh her, because you want to have no clothes on when you weigh the baby. For boy babies, which this one's a female obviously, but if I was going to assess a boy baby, it's a little different, well, a lot different. The first thing you'd want to do is make sure the testes are descended. And by doing this, you're going to do this on both sides. You're going to press your finger down on the inguinal canal, and then with your other hand, you're going to check to make sure the testy is there. And then you're going to do it to the other side, just to make sure the testes are both there. You're going to check the rugae and see if they're present. Preterm babies will have less rugae than term babies. You're going to, and that's going to be looking on the scrotum. And then you're going to lift up the penis, and depending on if it's circumcised or not, if it's not circumcised, you're going to retract the foreskin just a little bit to check the urinary meatus, which should be centered and on the tip of the penis. And then if the baby is circumcised, you're going to check the circumcision site just to make sure there's no irritation or extra redness or bleeding. The bleeding part is really important. If it is bleeding, you want to apply gauze to it and hold pressure to it. If it doesn't stop, you want to let the healthcare provider know right away. Okay, so after that, I get baby redressed and either give them to mom or maybe the nursery. And that's it.